Welcome once again to my channel. If you are seeing me for the first time, I am Nurse Z. In today's video, I want to create awareness about breast cancer. Breast cancer is the most common diagnosed cancer type, accounting for 1 in 8 cancer type worldwide. In 2020, about 2.3 million of persons were diagnosed to be having breast cancer for the first time. Breast cancer seems to be diagnosed most times at the advanced stage, making survival rates very, very low because women possess little or no knowledge about the signs and symptoms or ways of detecting breast cancer early. Now, for those who are aware, there's always this hesitation to seek for help due to a lot of factors ranging from socio-economic factor, religious factor, cultural factor, which may lead to an untimely death. But with enough awareness, education, and healthy lifestyle, these statistics can be reduced and the lives of women will be preserved. So you'll be doing yourself and the society real good by sharing this video so that women can be aware and educated about breast cancer and ways of detecting it early so that these increasing statistics can stop. I want to specially dedicate this video to every woman out there who has been diagnosed for breast cancer, those who have lost their loved one to any form of cancer. My word for you today is this: keep being strong, keep pushing, don't give up. You are stronger than you think. Because there's a can in cancer, you can beat it. Breast cancer is a disease that causes the cells of the breast to grow out of proportion. Every normal cell of the body follows a normal order. They know where to start and where to end. That is why the cells of the body has the ability to die when they grow old, which is what we usually call a cell suicide. Breast cancer affects both men and women, but the most affected is the female gender. The human system has a security check that ensures the cells of the body are in order. They don't go outside their boundary. The common one is the gene P53. They dictate any abnormal cell and stop it from growing. It helps to keep the cell system clean. Sometimes some bad guys, some bad cells escape this security checkpoint, go into the cells and start causing problems, especially when the security check is faulty and cannot perform its function as expected. In the case of breast cancer, there is no exact cause to why the cells of the breast grow beyond their boundary or grow out of proportion. But there are risk factors that has been linked to why these cells grow out of proportion, and these factors are called risk factor for breast cancer development. One of these risk factors is excessive exposure of a hormone known as estrogen. You know, the body of a woman is exposed to a lot of things, ranging from what she eats, the environment she finds herself, chemicals, radiations, food, sunlight, plus estrogen. This estrogen is the hormone responsible for puberty, for menstruation, for ovulation. It also helps in breast development So you can see that this hormone is very important in a woman. But excessive production and exposure of the woman to this hormone is what increases her risk to developing breast cancer. Throughout a woman's life, she is exposed to this hormone. Except when she is pregnant or breastfeeding, her exposure to this hormone is very, very low and minimal. So what are the things that can make this woman exposed to this hormone for a long period of time? Early menarche and late menopause. Her age at first pregnancy. When a woman chooses not to breastfeed, she is doing herself more harm than good. Because when she is breastfeeding, her exposure to this hormone is reduced. So if you are a woman and you have the privilege of giving birth to your own child, I want to encourage you, breastfeed your child very well. Another thing that can expose a woman to this hormone is the use of combined contraceptives. These hormones are very high in estrogen. Or postmenopausal use of hormonal therapy, to augment or avert the side effects of menopause, can expose this woman to estrogen excessively. Another risk factor for breast cancer development is family history of breast cancer or any other form of cancer. The next risk factor is genetic, what we call genetic mutation. And the commonest one is what we know as the BRCA1 and BRCA2, which is known as the breast cancer gene. Everyone has this BRCA1, BRCA2 gene, and what it does, it protects the body from developing certain cancer, including the breast cancer. But when there's a mutation in this gene, it loses the protective ability, and now that person stands the risk of developing breast cancer. Other risks of developing breast cancer include exposure to radiation, the age, unhealthy diet, harmful use of alcohol, smoking, unhealthy lifestyle, unhealthy eating habits. For people who eat food preserved with chemical, they are increasing their risk of developing cancer, including breast cancer. Smoked and processed meats or fish increases one's risk of developing breast cancer. Now, when this smoke mixes with the oil in the fish or in the meat, they combine together to form an aromatic hydrocarbon. These aromatic hydrocarbon are carcinogenic substances that increases your risk of developing breast cancer. What are the signs and symptoms of breast cancer? Note this, not all breast lump is cancerous. Some are just benign. One of the signs of breast cancer is the presence of a painless lump in the breast that is, movable, that is palpable. You can feel it when you touch it. Another sign is obvious change in the size of your breast. You can notice it when you stand in front of a mirror. You discover that one breast is larger than the other. Change in the skin of the breast. You will see the skin of the breast looking like that of an orange peel. That's the back of an orange. Another sign you will notice is the change in the nipple. Sometimes the nipple can become inverted, like it is drawing in, it is going inside or moving towards one side. And then sometimes when you press the nipple, you see fluid coming out of it. Once you present with any of these features suggestive of breast cancer, you will be subjected to series of diagnostic tests that will actually prove that you have breast cancer. So what are the treatment options for breast cancer? Number one is removal of the affected breasts, the use of anti-cancer drugs, chemotherapy, radiations. This treatment option is depending on the stage of the cancer. That is why early detection is very important. Please don't sit back at home if you have any symptoms suggestive of breast cancer. Young women, listen to me. There is nothing fanciful about breastfeeding. When you breastfeed your baby for at least 2 years, you protect yourself from developing breast cancer. And also your baby is well nourished. So first tip for breast cancer prevention is breastfeeding. Second is diet. Develop a healthy eating habit. Be deliberate about what you allow into your mouth. Eat food rich in vitamins and vegetables. Take advantage of nature. Choose plant protein over animal protein. Eat healthy nuts. Drink a lot of water. Stay hydrated always. Avoid processed food. Avoid food stored with preservatives. If you must eat these things, make it minimal. Remember, the poison is in the dose. Be physically active. Don't live a sedentary lifestyle. It is not enjoyment. Avoid exposure to radiations. Early detection and identification is very important. That is why you need to do a breast self-examination, which is done every month, at least 1 week after your menstrual period. You examine your breast and check it properly for the presence of lump or any abnormal skin change, either in the skin of your breast or your nipple. There's also what is known as the clinical examination. In this clinical examination, it is done by a health practitioner, a doctor, a midwife, a gynecologist who will help in examining your breast for the presence of those signs that is detective of breast cancer. Mammography is also done, which is the use of a low dose form of radiation. This is very important because it can pick the minutest, very little form of lump even before they become big. And finally, genetic testing can also be done for people who have family history of breast cancer. Early detection will make a great difference. God wish for every woman, for every one of us, is that we be in good health. So please, forward this message to your loved one. Forward this message to your mother, to your sister, to your auntie, to your friend, to everyone, so that women can be aware about breast cancer, how it can be detected early, and what to do to prevent breast cancer from developing. Please also remember to like our video, subscribe to this channel so you get updated every time we post a new video. Remember, Nurse Zicares. See you in my next video.